In this video, we're going to talk about knee pain. So this is knee pain. This is not an acute, untreated injury, but if we have knee pain, then these are some things we can do. So the knee, or the kneecap, the patella, is a bone that's actually suspended in the tendons of our quadricep. So it's important to address the quadricep and also the hip, anything that can cause tightness, because when the muscles get tight or the body, the bones start to move and shift and it puts tension on that, then the kneecap has more tension, and often that's a source of the pain because the kneecap isn't able to float and move as freely as it does. It has tightness and restriction, and there's pulling. So a lot of the times that's where the pain comes from. So we'll talk about a couple different stretches to do and some releases to do specifically for the knee. So the first thing is going to be, we're going to stretch the hip and side body and leg. So if you have a strap, you can also do this with your hand if you don't have a strap. We're going to lay on our back. Put the strap around your foot. If you cannot straighten your foot, that's okay. Or if you cannot straighten your leg, that's okay. So we'll have the strap around it, and then we're gonna just come over to the side. And just go to wherever you can. And just kind of let the leg can kind of melt into the strap. If you can't fully straighten it, that's okay. Just go to what feels okay to you. And just take a couple deep breaths in and out. You want to hold this stretch for 1 to 2 minutes to give the fascia time to release. You can put your arm up. If it gets too intense, you can come back out of it and then go back into it. And each time you do that, maybe you'll be able to go a little bit further. Try to hold it for 3 breaths before you go back out of it and into it. Okay. And you'll want to do that stretch to both sides, of course, even if you only have knee pain on one side. The next thing we're going to do is we're just going to assess the knee, and you can do this first. Just bend it and just take note of how much bend you have, where you feel any tightness or restriction. And do the same with the other knee, if that's comfortable for you, just so you can see if there was any changes afterwards. All right, the next thing is going to be rolling the hips and the quadriceps. So if you have a foam roller, most gyms also have foam rollers, so you want to do that. If you don't, you can get creative and use, you can use like a harder pillow. I don't recommend using like a can. Cans can be pretty intense, but if you have something round that you can lay on top of and put some pressure on. So these you're also going to want to hold for 90 seconds to 2 minutes to let the fascia release. So we'll go ahead and do the different foam rolls you're going to want to do are on the quad. Just go ahead, you can roll up and down and see what area feels super tight. Like maybe right there, and then just pause there and let everything kind of melt into that tissue. And you'll hold that for 90 seconds to 2 minutes, and then find the next area and go through that. And kind of just roll up and down and explore what feels super tight. Then you'll come a little bit more to the lateral side, to the outside, and do the same there. You can even rock back and forth a little bit. And we'll also do the same to the hip. So you're gonna have your hip joint, and you're gonna work up and around it, kind of in a circular fashion. So you can do that here with the foam roller. Go above it, and then also below it. Because when those hips get super tight, they rotate externally or internally, which causes strain and tension on the quad, and therefore the patella and the kneecap as well. Sometimes you'll see people with legs, feet rotated out or in, and a lot of that tightness is coming from our hips or our quads. Another good tool to use, you can also do this with a tennis ball or a lacrosse ball if you have that at home. You can also use the orb or a circular, and you can do it on the ground, or you can do it standing against the wall if that's more comfortable. Maybe you can't find a spot to lay down, or maybe it's too intense when you lay down. You can do it standing against the wall and just work around that hip joint, in the glutes in the back as well. So those are going to be the stretches that we will do. You can also, a very simple one is going to be just kneeling. So you have your feet tucked in and then kneel like that. For some people, that's enough of a stretch. For some people, that's too much. So you can put a pillow or something right there so that it's not as much of a stretch on the quadriceps. And sometimes that's not enough, so you can lean back a little bit. Just find where you feel that stretch. And again, you're gonna wanna hold it for 2 minutes to let that tissue melt. Or if you can't hold it for 2 minutes, hold it for as long as you can. All right. Now, what we're gonna do to help with the tendon pain specifically is, or the knee pain specifically, is you can do this with a racquetball, a trigger point ball, your thumbs, your fingers, and whatever you have available to you. So the first thing we're going to do is we are just going to roll from the middle of the leg to the outside. So we're just going to kind of bring the blood flow in to this fascia. So we're going to roll just above the kneecap. And again, if you're doing this with your thumb, you can just kind of go back and forth. And then we're going to do it below the kneecap as well. Okay, and do that to both sides. And then we're going to do it with the knee bent. So it has a little more tension in the area. Again, if you're using your thumb, just go from the inside to the outside and back in. We're just kind of bringing the blood flow to this area and below the knee, so around the kneecap. If you have a ball, that's great as well. And just play with what depth, what tension feels good. Next thing we're going to do is you're going to want to be seated for this. So I'll grab a chair. And we want to sit because we want to be able to have the knee bent and then straighten it. So the leg that we just worked on and got all warmed up, we're going to take that ball or your thumb, whatever you're using, and we're going to go in 3 different spots. So we're going to go medially, in the center, and then laterally. So you'll have one here, and one here. And the goal is to grab that quad muscle and pull it and then give it some stretch. So for the start, we're going to go, you'll have your leg bent. I'm gonna have you start medially, but I'll show you on the outside. So your leg is bent. You're gonna go right above the knee, just below where your quad starts. And you're gonna push the ball in there, or your hand, and then you're gonna pull the tissue back towards you. So push in and then pull, just kind of like you're pulling that quad muscle away. Once you have a good grip on it, go ahead and straighten the leg. And then bend it and straighten, and you'll do that 5 times. So we have pressure here, and we're pulling the muscle up and kind of holding it there, and then straightening and bending to create some tension and release and kind of get that area unlocked and moving. So we're going to do that medially first, in the middle first. Do that 5 times. Then you're going to go right above your kneecap in the center. Push in, pull back, and do that 5 times. And then you'll go to the side, push in, pull back, making that length, and do that 5 times. And then you'll go once below the kneecap right here. You're going to push in and pull up. So push in and pull up. And do that 5 times. Okay, and make sure even if you only have pain in one knee, that we're doing it to both sides so that we're equal and balanced. And the stretching is a really important part of that because the fascia is all connected. So our muscles are connected, tendons are connected. So you definitely want to do the stretches as well. And then the ball. And I would recommend starting off with every other day, just so you don't shock your body or irritate it too much, and see how it goes from there. If there is a lot of pain, you can always ice it after doing these things, but you don't want to ice it and then do an activity. So if you're gonna ice it and make it cold and kind of make it stiff, because when you freeze it, the blood flows less, the inflammation is gonna go down, but it's not going to be ready to activate right after it. So if you do ice it, make sure you do it so that when you can rest a little bit. So after a workout, after the stretching, then you can put some ice on it and just chill for a little bit. So you don't want to ice it for more than 20 minutes. I would do probably 5 minutes and then take it off and walk around. And if you need to do the stretches a little bit more, that's okay. And then eventually over time you can go to every day, but hopefully you won't need to because it will feel better. All right, I hope that helped.